Okay, so let's unpack this deep dive.
Yeah.
You've sent us quite a stack of sources, really clinical stuff. Yeah, all about.
Right. All focused on when things aren't quite right, in the scrotum and tests of male horses. We're looking at papers and research that really get into the weeds.
Diagnosis and treatment, the real technical details.
Exactly. The essential stuff that vets need for these specific health issues.
And our mission for you listening is to kind of pull out the most important bits, whether you're prepping for something, catching up, or maybe you're just, well, curious about horse health. We want to walk through what these abnormalities are, what kicks them off, how vets figure it out.
And the treatment paths, yeah. With a real focus on how it affects, size, consistency, and ultimately that fertility question.
We'll stick to your sources,
Yeah.
aiming for clarity, hitting the key points without hopefully getting too bogged down in jargon.
Sounds good.
Perfect. So look, to get what's abnormal, we probably need a picture of normal first. Can you set that baseline for us based on the sources?
Absolutely. So the sources describe the normal equine testis as basically ovoid in shape, and it sits freely within the scrotum.
Okay.
Size is definitely a key thing. For a mature stallion, you're typically looking at, say, 8 to 12 centimeters in length, maybe 4 to 6 wide. And there's this measurement, total scrotal width, TSW.
TSW.
Yeah, and the sources point out it correlates pretty well with sperm output. So yes, size definitely matters for fertility potential.
Okay, size is important. What about how they actually feel?
Right, consistency. That's vital. They should feel firm, kind of resilient.
Not rock hard, not mushy.
Exactly, and they need to be freely movable in there. Position is also critical. Being outside the body, that's all about thermoregulation.
Keeping things cool.
Precisely. It needs to be about 3 to 4 degrees Celsius cooler than the main body temp. That's just essential for healthy sperm.
The horse's built-in cooling system.
You got it. And you can also feel the epididymis that's attached to the testis where sperm mature.
Right.
The sources describe feeling its parts, head, body, tail, usually kind of towards the back and slightly middle of the testis. And then the spermatic cord runs up from there carrying, blood vessels, nerves, the tube for sperm.
Got it. So, okay, that's the normal picture. Now, the sources group the problems, right? Abnormal scrotal size versus abnormal testicular size.
Yes, that's often the first clinical split. Is the whole sac enlarged, or is the testis itself too big or too small?
Makes sense.
And importantly, these changes can be unilateral, just one side, or bilateral, affecting both.
Okay. Now, some of these problems can just, bam, show up suddenly, right? Acute things, often painful. Others creep up over time. Let's tackle the acute ones first, the emergencies.
Yeah, these are often sudden, dramatic events. Trauma is definitely high on the list in the sources.
Like a kick.
A kick, a breeding accident, maybe a fall. This can cause bleeding inside a hematocellular or just general swelling, bruising, or even a rupture of the testis itself.
Rupture sounds bad.
It is. The sources are clear. Testicular rupture is a surgical emergency. You'll see sudden, painful swelling, heat, maybe bruising. The horse might be lame, won't want to move.
Wow. Okay, besides direct injury, what else causes sudden severe problems?
Spermatic cord torsion. This is where the cord twists on itself.
Ouch.
Big ouch. The sources explain it cuts off blood flow, first the veins, then maybe the arteries, leads to ischemia, tissue death, fast. The classic sign is acute, really severe pain, usually just on one side.
Okay.
And interestingly, because it pulls on things inside the belly, it can look exactly like severe colic.
Seriously, colic signs could be a twisted testicle.
Absolutely. It's a critical differential. The testes feels really firm, enlarged. And the sources highlight Doppler ultrasound, the one that shows blood flow is crucial to diagnose this.
That's a really important connection to make. What else is acute?
Well, inguinal or scrotal herniation. That's when intestine slips down through the inguinal canal into the scrotum.
Oh, right. I've heard of that, especially in foals.
Yeah, common congenitally in foals, but adults can get it too, maybe after exertion or breeding.
Yeah.
The big worry here is strangulation.
Where the blood supply to the gut gets cut off.
Exactly. That's another emergency. You see sudden scrotal swelling, maybe feels kind of doughy or firm. And again, often colic signs are part of the picture, becoming severe quickly if it strangulates.
So trauma, torsion, hernia. What about infection?
Yep. Inflammation, orchitis, that's the testis, and epididymitis, the epididymis. These can pop up acutely too.
What causes them?
Could be bacteria, the sources mentioned, Streptococcus zooepidemicus specifically, or viruses like EVA or EIA, even parasites like Strongyles identatus larvae migrating.
Wow, parasites too.
Yeah. Signs are pretty typical for inflammation. Acute pain, the area feels firm, hot, swollen, Often the horse has a fever, seems depressed, and semen quality tanks.
Okay, so those are the sudden, often alarming issues.
Yeah.
But then there are the problems that develop more slowly, the chronic ones, or things present from birth.
Right. Moving into the chronic abnormalities. A really significant one mentioned is testicular degeneration, or atrophy. This is a gradual shrinking and acquired loss of size.
What causes that?
Several things listed in the sources. Heat stress is a major one.
Like a prolonged fever.
Exactly, or just really high environmental temps if the horse can't cope. Also, previous trauma, maybe lingering effects of infection, certain toxins, or simply getting older.
So basically, the testes environment becomes unhealthy over time.
That's a good way to put it. The seminiferous tubules, where sperm are made, get damaged. Sperm production drops. Clinically, you see the testes gradually get smaller, often feel softer.
And fertility declines.
Definitely. Progressive decline in semen quality, low count, poor shape, poor motility. And this degeneration, it's often bilateral, affecting both sides.
Okay. What if the testes was just small from the start?
That could be testicular hypoplasia. This is congenital, underdeveloped from birth. The sources say they're just abnormally small for the horse's age, maybe feel a bit hard or dense.
So they just don't have the machinery.
Pretty much. Poor capacity for sperm production right from the beginning leads to infertility or subfertility.
And then there's cryptorchidism, the retained one. That's pretty well known.
It is a key chronic issue. Failure of one or both tests to make it down into the scrotum, usually diagnosed if they're not down by, say, 12 to 18 months.
Where do they get stuck?
Could be anywhere along the path, high up in the abdomen or down in the inguinal canal. Genetics are thought to play a role.
And the important thing is,
Well, two things, really. First, the retained testes is too warm, so it's infertile. But, and this is crucial, it still makes testosterone.
so they still act like a stallion.
Exactly. Normal masculine behavior, even if both are retained. The second key point from the sources, these retained tests have a much higher risk of developing tumors, neoplasia.
So even if you don't care about breeding, that cancer risk is a big deal.
It absolutely is. It's a major reason for recommending removal. The main sign you see is just, well, an empty scrotum on one or both sides, often with stallion behavior.
Okay. And speaking of tumors, they can arise in normally descended testes too, right? As a chronic issue.
Yes, testicular neoplasia, more common in older stallions and, as we just said, in cryptorchid tests. The sources mention seminoma is the most frequent type, comes from the sperm-producing cells.
How do they present?
Often as a gradual enlargement, might not be painful initially. The testes can feel quite firm. Other types like interstitial cell tumors or Sertoli cell tumors are also mentioned.
Any other chronic things? Like fluid?
Yep. Fluid can build up in the tunic, the sac around the testes. If it's just clear fluid, that's a hydrosol, often chronic, maybe not painful. If it's blood, a hematosol, usually started from trauma but can become chronic. And varicose is mentioned too, dilated veins in the spermatic cord.
Wow. Okay. That is a lot of different possibilities, from sudden emergencies to these slow burners. So how does a vet piece this puzzle together? How do they figure out which problem they're dealing with?
It's definitely detective work. Starts with the basics, a really thorough history, and a good physical exam.
Asking things like, how long has this been going on? Sudden or gradual? Painful?
Exactly. Any history of injury, breeding. Then the hands-on exam is critical. Careful palpation of the scrotum, the testes checking size, consistency, temperature, pain, feeling the epididymis orientation, the inguinal rings.
Feeling those openings.
Right. And rectal palpation is important too, especially if you suspect a hernia pushing in from the abdomen or trying to feel for a retained testes way up high.
Okay, so feeling gives you clues. But you can't feel everything, right? What's next?
Imaging. An ultrasound, according to these sources, is really the gold standard. It lets you see inside, visualize the structures.
What can it show you?
All sorts of things. Like you might see loops of bowel if it's a hernia. Fluid, maybe with fibrin strands suggesting rupture or a hematocele. It shows the actual texture of the testes, the echotexture.
Texture.
Yeah, changes in texture can indicate inflammation or a tumor or degeneration or that congenital hypoplasia. And Doppler ultrasound, as we mentioned for torsion, is fantastic for checking blood flow.
So ultrasound is a huge help. What about blood tests or lab work?
They play a role. A CBC complete blood count can show signs of inflammation or stress systemically, like high white blood cells. Sometimes high eosinophils might hint at that parasitic cause, Strongylus edentatus. And specific disease testing, like for EVA or EIA using blood tests. Though, interestingly, for confirming an EVA carrier stallion, the sources say semen testing looking for the virus itself is actually the best route.
Gotcha. And hormones. You mentioned testosterone before. Are hormone tests used often?
Yes, especially for cryptorchidism suspects or maybe certain tumors. A baseline testosterone level helps see if any functional testicular tissue is present.
But what if it's retained? How do you prove it's there?
That's where the HTG stimulation test comes in. It's considered the definitive test.
I know that works.
You get a baseline testosterone level from blood, then inject HCG that stimulates the testosterone-producing cells. Then you take another blood sample a bit later if testosterone levels jump up significantly.
Bingo. There's functional testicular tissue somewhere.
Exactly, whether it's descended or hiding. The sources also mention estrone sulfate testing that can be useful specifically in older stallions, over 3 years old, as it tends to be high in cryptorchids.
Clever. Okay, what about looking at the semen itself, assuming you can collect it?
Oh, absolutely crucial, particularly for breeding stallions. It directly tells you the impact on fertility.
What might you find?
Well, you might find very few sperm oligospermia or none at all, azoospermia. You look at morphology. Are the sperm abnormally shaped? That's pterodozoospermia. How well do they move? Decreased motility. Are there inflammatory cells mixed in?
So it gives you a functional readout.
Precisely. Really useful for diagnosing things like degeneration, hypoplasia, or maybe a blockage somewhere.
And if you really need to know what a lump is, or confirm degeneration,
Then you might move to a needle aspirate, or even a biopsy. Aspirate pulls out fluid or cells for cytology. Biopsy takes a tiny tissue sample for histopathology, looking at the tissue structure under a microscope. That gives the definitive diagnosis for things like tumors or confirming degeneration hypoplasia. But, as the sources note, biopsy is invasive, carries risks, so it's not done lightly.
Right. Okay, so we've gone through history, exam, imaging, labs, hormones, semen. We have a diagnosis. What's the path forward? What did the sources say about treatment?
Fundamentally, treatment targets the specific cause, but a couple of general principles run through the sources. Managing inflammation is almost always important, and sexual rest is pretty much standard procedure for nearly all these conditions.
Okay. What about non-surgical medical options?
Yeah, conservative medical management works for some things.
Yeah.
Maybe uncomplicated trauma, milder inflammation, small hydroceles, or trying to manage degeneration.
What does that involve?
Things like cold therapy, ice packs, hosing, though the sources warn against that if you suspect rupture. NSAIDs are key bute or flunixin for pain and inflammation.
Standard anti-inflammatories.
Right. Antibiotics, if there's infection or open wounds from trauma, maybe diuretics like furosemide to help with swelling. And if parasites like strongylosis are the cause, then dewormers like ivermectin.
So, supportive care, basically. When does surgery become the main option?
Orchidectomy, removing the testis, or hemicastration for just one, is often the go-to, sometimes urgently. The sources list emergencies like testicular rupture, torsion where the testis isn't viable anymore.
No saving it.
Right. Or a strangulated inguinal hernia. Fixing the hernia often involves removing the compromised testes, too.
Makes sense in those critical situations. What about non-emergencies?
Surgery is also indicated for things like severe orchitis with abscesses, confirmed unilateral tumors, big hydroceles or hematoceles that don't respond to medical treatment, or maybe varicocele.
And of course, cryptorchidism.
Absolutely. Cryptorchidectomy, removing the retained testis, is surgical. And the sources emphasize it's usually trickier than routine castration because you have to find it first. Different approaches are used depending on where it is abdominal or inguinal.
Okay. And they might try to repair tears in the scrotum itself.
Yes, repairing scrotal lacerations is important to protect what's inside, though the sources mention swelling can sometimes cause these repairs to break down.
Right. So we've gone from ice packs to major surgery. Thinking about the horse's future, especially breeding prospects, what's the prognosis? What do the sources say about fertility outcomes?
It really, really varies. Depends completely on the cause, how severe it was, and how quickly it was treated. Generally, the sources suggest a good prognosis for recovery and potentially fertility, with things like mild trauma or uncomplicated inflammation that's treated well, or removing a benign unilateral tumor, or after successful cryptorchid surgery.
Okay, so some conditions have a decent outlook. When is it more guarded or poor?
Things look more guarded to poor with severe bilateral problems like advanced degeneration or inflammation on both sides. Also severe trauma with rupture, significant tissue damage from torsion, a strangulated hernia history, or malignant cancer.
And fertility specifically, can it bounce back?
It might be permanently lowered or even gone completely. Testicular degeneration, for example, often leads to lasting subfertility. But on the positive side, the sources do mention compensatory hypertrophy,
Mm,
meaning if one testes is removed, the remaining healthy one can often ramp up production to compensate, at least partially. So unilateral removal doesn't always mean the end of a breeding career.
that's good to know.
Yeah.
Any advice on checking fertility after recovery?
Definitely. The sources strongly recommend follow-up semen evaluations, usually starting around 90 days after everything's resolved or after surgery. That's the objective way to see where things stand fertility-wise.
Makes sense.
And one more really important point, especially for breeders, conditions like cryptorchidism and hypoplasia are suspected to be genetic. The sources stress advising owners against breeding affected stallions to avoid passing these issues on.
That's a crucial piece of advice for responsible breeding.
Absolutely. It's about the health of future generations, too.
Well, this has been quite the journey from normal anatomy through all the potential pitfalls, acute, chronic scrons, the diagnostic tools, the treatments. It's clear that just seeing, say, a swollen scrotum is only the very beginning. You really need that thorough investigation.
Exactly. And what really stands out from these sources is how critical that precise diagnosis is. You can have similar outward signs, like scrotal enlargement, stemming from vastly different causes: trauma, torsion, hernia, infection, tumor. Each needs a specific approach. And getting it right fundamentally dictates the horse's future health and, of course, its potential fertility. It just highlights you can't skip the detailed workup.
It really does drive that home. Thank you so much for sharing these sources and walking us through them. It's been incredibly informative.